Huron Perth Healthcare Alliance introduced a patient and family experience framework last year, and it's about building an infrastructure where the voice of the patient and the voice of the staff come together to co-create the way we deliver care and also the services in the organization.
The change of shift report, or the transfer of accountability, is the time when the responsibility of patient care is transferred from one nurse to another.
This is a really busy night. Morning, ladies.
Good morning.
This is Bob, Janice, this is Cathy.
Nice to meet both of
And
you.
Bob, yeah. She's going to be your nurse for the day till 7 tonight. Cathy, at this point we usually do a quick shift report, and if it's okay with you, we'll stay at the bedside.
Great, that'll be
All right, if Bob sticks around?
Yeah, I'd like if Bob would stay.
So Cathy came to the hospital 3 days ago. She had some abdominal pain, nausea, vomiting, ended up with a bowel obstruction. Dr. Smith took her to the OR yesterday.
It's really nice to have a transfer of accountability at bedside, because as a patient sometimes we really don't know what's going on, what test results have been, or what might be ahead of in the day for us, whether or not the doctor is coming, those discussions. It's also really nice to know who's taking care of you. When one nurse leaves, it's nice to know who's got your back.
She has a history of asthma and GERD.
Yes. May I ask you what GERD is?
GERD is a term we use for acid reflux.
Okay, thanks.
Cathy, you're doing really well post-operatively, yeah. Vital signs have been stable, no problem there. She has an intravenous normal saline running at 125 an hour, that's about 1 cup an hour. Nasogastric tube, very uncomfortable for you, nasty on the throat, right? Fortunately, it only drained around 75 cc's of clear brownish fluid. So Dr. Smith has said that we can clamp this nasogastric tube. If you tolerate it being clamped, you don't get nauseated or bloated, then it will come out later today. Now this morning you had some Dilaudid. Was that effective?
It was, but I'm really feeling very groggy now.
Right. Next time you have some analgesic, it might be a good idea to step down a little bit, just because it is making her so drowsy, so not quite such a heavy dose perhaps. I think that's just about everything. So the plan for today: oxygen out, nasogastric tube out, Foley catheter out, probably reducing the rate of the intravenous, getting up to walk, really important, and some clear fluids.
Good.
Any questions at this point?
Just wondering, do we happen to know when Dr. Smith will be in today?
He usually arrives around 11:30 in the morning.
Okay, because that would be kind of nice if Barb could be here at that point too.
Yeah.
I can stay. Yeah.
Thanks, Barb.
You're welcome.
I won't be back. I'm off for a few days, and I'm sure you'll be home in a couple, so nice to have met you.
All right, nice to meet you too. Thank you for everything.
And I'll be back in a few minutes to clamp your nasogastric tube and to remove your catheter.
Okay, thanks, Janice.
Call me if you need me.
All right, thanks, Janice.
Take care.
Yeah, bye-bye.
Bye-bye.
Transfer of accountability at bedside is really important for the patient, as it really helps to reduce anxiety and stress levels for the patient, as they know what is going on and what the results of tests might be. It helps us plan our day and put us at ease for what might be ahead.
There are several benefits to the bedside transfer of accountability. I know it alleviates patients and their families' concerns. That, to me, is the best part of it.
As a family member, I'm aware of what the patient's medications are and if there is any changes taking place. I can also share information about the patient's past history and maybe something that has been forgotten upon admission.
I particularly enjoy meeting the families, because I generally get little gems of information from them that just wouldn't come across any other way.
It's important because patients are becoming very aware, and that we're part of that discussion, so that we can work together for the very best level of care that we can receive.